Ladies and gentlemen, welcome and thank you for joining today's conference, Global Review of National Contingency Plans. Please note that all participant lines will be muted throughout the call to reduce background noise until the Q&A portion of the call. I'll provide instructions on how to ask a verbal question at that time. You are welcome to submit written questions as well, and these will be addressed during Q&A. To submit a written question, use the chat panel on the lower right-hand side of your screen and choose All Panelists from the Send To drop-down menu. If you require technical assistance, please send a private chat to the event producer via the chat panel located on the lower right-hand side of your screen. With that, I'll turn the call over to Liz Fernandez. Liz, please go ahead.
Good afternoon, everyone. I'm Liz Fernandez with the Professional Development Services Branch. Our speaker today is Dr. Jennifer McDougall. Dr. McDougall is a 2002 graduate of the University College Dublin, Ireland. She has spent most of her career as a small animal veterinarian in Oregon and California, including 3 years as a municipal shelter veterinarian. She completed the Koretz Shelter Medicine Fellowship with UC Davis in 2007, and she joined the U.S. Army Reserves in 2011 and maintains her status as captain in the Individual Ready Reserve. Through her experience with the military, Dr. McDougall became knowledgeable about food inspection, food defense, and enjoyed her work with large and small animals in various places, including Guatemala and above the Arctic Circle in Alaskan Indian villages. For the past 3 years, Dr. McDougall has been a field veterinarian for the California Department of Food and Agriculture in the Animal Health Branch with involvement in biosecurity programs and the incident management team as a planning team leader, garnering experience in preparedness drills for foreign animal diseases such as foot and mouth and avian influenza. She is the Tulare District Lead for bovine cysticercosis, feral swine outreach, and avian surveillance programs. Dr. McDougall has created numerous outreach.
Your connection is now in listen-only mode.
Backyard hobbyists, and veterinarians. Dr. McDougall is now completing a 6-month internship with the World Organization of Animal Health at the OIE headquarters in Paris, France. She would also like to thank Dr. Keith Hamilton of the OIE for his guidance and for the opportunity to be educated and work in emergency management at an international level. And with that, I will turn it over to Dr. McDougall.
Thanks very much, Liz, and thanks to everybody for joining me today as I present this review of Global National Contingency Plans. I saw quickly before I was on the main presenter screen several of my colleagues and friends that are on the phone line, so it was really nice to see that since I'm here in Paris in a big empty room and everyone's gone home for the day because it's the evening. So hello to everybody. And these animal disease emergency plans that I'm going to present today, I hope that the information that I present here, I hope that it will be interesting, and I hope that it will give you a new perspective on preparedness and maybe give us all further ideas on how to improve animal disease planning in our own communities and states. So with that, I will start with the first slide here. And there are some technical difficulties over here. There we go. So the first slide, as you can see, it illustrates the changing logo of the OIE over time, because I'm going to start this review with a very brief explanation of a little bit of the history of the OIE, and as well as that go over the OIE structure and purpose in the international community. The OIE, this international community, it's a collaboration that started at the beginning of the 20th century, and Rinderpest was really the first foreign animal disease, or FADs as we call them, to bring a group of countries together for animal disease strategy. In 1925, this collaboration with an initial 28 countries was formalized and created what was then the Office International de Epizootics. And that original name is the derivation of the acronym OIE that we use today. But they did vote to change the official name to the World Organization for Animal Health. And I'm going to mention, I think you all know, but I'm just going to mention that in British English, organization is spelled with an S. So that's why that way to you. And as we go into this review, the next thing I want to discuss is that just how much the OIE has grown since that initial startup. And now there are 182 member countries. This slide displays the 5 OIE regions with the number of member countries per region. OIE representatives are located in each of the 5 regions. The OIE isn't a governmental organization, but an intergovernmental organization, which I think is really important to recognize. And it takes on the responsibility for improving animal health worldwide. Each member country has 1 delegate and 1 vote, which is also important, as together this assembly of member countries decides the direction of animal health improvement globally. The current project to review approaches to national contingency plans or animal disease emergency plans at a global level, it's part of the OIE's 5-year work program. This strategic plan covers the period from 2016 to 2020. Assistance for Emergency Management Planning addresses several of the strategic plan objectives, which are transparency of health information that's provided by member countries, risk management for the health and welfare of animals, as well as supporting and strengthening veterinary services. Now, in order to identify challenges in animal disease emergency preparedness and also learn from country experiences, the OIE began with a study to identify and examine what current national contingency plans exist. And the goal of the study is to help facilitate fit-for-purpose and sustainable approaches to emergency management. Approaches to capacity building should be evidence-based as much as possible, as this helps to identify specific regional or country needs. And it also helps find approaches that work best and will be most cost-effective and locally appropriate. Evidence-based approach to emergency management began last year with a project that had 2 outputs. One was to get an overview of global capacity for emergency management planning to identify through a simple analysis trends in contingency plans. And 2, a web-based platform was created to share contingency plans that were collected. This work isn't complete, and what's being presented here today is just a preliminary snapshot. There's further work being done on drivers of emergency management and cost-effective approaches that will benefit all member countries. The review today is going to address the questions shown here, including what's the international guidance that currently exists and what trends exist in contingency plans. The trends are really important to know and just to learn what countries are doing in different regions and how approaches may vary due to regional characteristics, such as the structure of the livestock industry, cultural differences, available resources, and physical geography. Guidance at the international level should be informed by country approaches in different regions. It shouldn't be informed by just one model, because one size doesn't always fit all. An example is, the incident command system. It works for us. It may not be the best model in other regions due to all the variations that exist. Also, what constitutes an animal health emergency varies from country to country and region to region. For some countries with export markets, an incursion of a foreign animal disease, it is an emergency, and response is focused on restoring export markets as quickly as possible. For other countries where these diseases are endemic, the emergency may be a sudden increase in incidence or spread of a disease to a previously unaffected area. Emergencies are also exacerbated by environmental factors, including climate change. Here's a slide, and this slide highlights the range and diversity of international guidance to support animal disease preparedness. And the main thing to take away from this slide is that the 3 main organizational bodies, the World Health Organization, the OIE, and the FAO, which is the Food and Agriculture Organization, collectively they are known as a tripartite. They have a recent collaboration, and their priority areas include AMR, pandemic preparedness, rabies, and emergency response. The World Health Organization and the OIE work together to strengthen global legal frameworks for public health with international health regulations and animal health with the OIE international standards. Non-governmental organizations, or NGOs, they also play a very important role in responding to animal health and welfare needs in disasters, and they should always be included in any animal disease emergency planning. The main focus of this presentation is on the review of approaches to emergency management. And it was based on 4 sets of data shown here. And it includes information that was publicly available from Performance Veterinary Service Evaluation Reports, or PDS evaluation reports. Also publicly available National Veterinary Service websites, national contingency plans that were voluntarily submitted by OIE members, and national simulation exercise data that was submitted to the OIE. The PDS evaluation reports are part of the OIE PDS pathway. This pathway is a global program for sustainable improvement of veterinary services in compliance with OIE standards. The first step involves evaluation of the veterinary service of the country against 47 critical competencies, which include resources and infrastructure of the veterinary services. The evaluation is entirely meant to help OIE members improve upon existing foundations and to help countries target resources effectively and not judge or rank countries. 2 of the core competencies specifically relate to emergency funding and emergency management, and we will review the results of these 2 competencies later in the presentation. The data available for this emergency management review includes 39 of the OIE member countries that agreed to share their plans. Of the remaining countries, some responded they hadn't vetted their plan and therefore were not comfortable sharing them, and others may not have shared their plans due to national security concerns. The OIE maintains confidentiality of member countries and only shared contingency plans on the web-based platform when the country had agreed that that plan could be shared. From the initial analysis of these data sets, it was revealed that 90% of OIE member countries have some form of national contingency plan. Based on the 4 data sets, the blue bars here represent the percentage of countries in each region that had some form of contingency plan, as shared or as found from public information in PDS data. Most countries had some sort of plan at various levels of development, and that means not only levels of development, but some had a plan for one disease. Some had many individual specific disease plans. Some had generic. Some had both generic and disease-specific plans. So it was kind of a wide variety. 2 regions that had the most plans among member countries were the European region, with 98% of member countries having contingency plans, and the Americas region, with 97% of countries having plans in that region. This bar chart takes the single disease plans and breaks them down by disease. The analysis found a total of 722 contingency plans for single diseases from 163 OIE member countries. It's not surprising 100% of these listed here are OIE listed diseases. The most common specific disease contingency plan was for highly pathogenic avian influenza, or HPAI, with 78% of countries having a plan for this disease. This is likely to be a result of the interest in HPAI H5N1, which I will say more about in another slide. It is interesting that for Newcastle disease, which also has a significant global burden, only 25% of countries had plans. Although HPAI is the most common disease-specific plan, when diseases are grouped by species, we see that most of the disease-specific plans related to diseases of ruminants, followed by poultry and then swine. The diseases listed include diseases such as bovine spongiform encephalitis, rabies, bovine tuberculosis, and these are frequently subject to national programs for control or eradication. The areas that were underrepresented include aquatic plans and bee diseases, which could be due to some member countries being landlocked and other country-specific characteristics. Aquatic diseases may also be under the authority of a different government agency outside the veterinary services. We have looked at single disease contingency plan trends together, and now these plans will be separated by species, beginning with ruminant-specific contingency plans. This slide illustrates 344 contingency plans from 163 countries, which specify ruminant disease. A takeaway from this slide is that the majority of these plans are for foot and mouth disease, 28%, which is not surprising because of the trade impact of foot and mouth disease. I'll also mention that rinderpest was eradicated in 2011, and the OIE required all countries that applied for disease-free status to submit a preparedness plan. The OIE and FAO are continuing to work on awareness and prevention against this disease and encourage countries to continue to be vigilant against its reappearance. And though the rinderpest virus is no longer in live animals, the OIE requires plans to be submitted on a cyclical basis for those countries that hold vaccines and biological samples. Of all the single disease plans, ruminant plans dominated in number. What we see here is that regionally, the majority of these ruminant disease plans are found in the Europe region, the Africa region, and the Americas region. This does need further analysis, but it may say something about regional priorities. For example, peste des petits ruminants, or PPR, is highly contagious and can kill up to 70% of small ruminants. PPR tends to be an issue in Africa and Middle East regions and is not present in the Americas region, which may account for the low amount of PPR plans in that area. Poultry disease plans were separated and examined as well. Here we have the poultry contingency plans separated by region. As I mentioned, the most common specific disease contingency plan found was for HPAI, with 78% of countries having a plan for this disease. In the early 2000s, the HPAI H5N1 epizootic spread to over 60 countries in 3 years, and as a zoonosis with a case fatality rate in humans of close to 50%, it was a considerable public health threat with devastating pandemic potential. Many countries responded by building capacity to detect and respond to H5N1. Newcastle disease also has a significant impact on poultry production and trade globally, but there are far fewer plans. A significant public health threat may be a driver for the development of contingency plans. Avian influenza and Newcastle disease are very much the same contingency plan in terms of response and control measures. Even though special public health considerations for workers may apply for HPAI, countries might consider a generic plan with disease-specific annexes where necessary to avoid duplication of effort. Moving on to swine, 113 contingency plans for selected swine diseases were separated for examination and are shown in the next two tables here. The most common swine disease plan found was classical swine fever, with 39% of the total swine plans. Classical swine fever is endemic in many countries with vaccination against classical swine fever practice. The endemic nature in some countries, as well as the use of vaccines, could be the reason there are more classical swine fever plans than the other selected swine diseases. Over the past 10 years, African swine fever, while remaining endemic in parts of Africa, has become a significant threat to pig production in Europe and Asia. In the past year, as it spreads through Asia, it is becoming a significant global threat now. Here we see the plans separated by region. In contrast to classical swine fever, African swine fever, or ASF, was traditionally confined to the Africa region, as I said. As we know, this disease has now spread to many countries with naive pig populations within the Europe and Asian regions, and the spread is continuing. 35% of selected swine plans were for ASF. The clinical signs of classical swine fever are very similar to ASF, but they have distinct and different epidemiology, including the ASF tick vector, as well as there's no vaccine for ASF. So while the Newcastle and avian influenza plans could potentially be combined to prepare against poultry diseases, the same is not true for classical swine fever and ASF, despite the similarities in clinical signs. There was an increase in African swine fever plans from the threat of this disease in the European region, especially in the wild boar population. We should expect a similar rise in ASF plans from the Asia-Pacific area with the current threat that exists in neighboring countries. It is important that these plans address feral pigs and increase surveillance data. I'll mention that no data available from the Middle East is likely due to cultural and religious factors, with no large population of swine in this region. So on to horses, where 42 of the plans collected were for equine diseases. The most common of the equine plans was for African horse sickness, comprising 50% of the plans that were available. 24% of the equine plans were for West Nile virus, and 14% were for vesicular stomatitis. The remaining 12% of equine disease plans were grouped together for diseases such as equine infectious anemia, equine influenza, and Hendra virus. Regionally, West Nile virus plans seem to be available in the OIE European region. No plans were found in the Middle East or Americas region. While vesicular stomatitis is confined to the Americas region, no vesicular stomatitis plans were available. Again, plans may exist but have not been shared, and thus we did not have access to this information for the review. The low number of equine plans obtained in the study tells us that horse diseases are possibly considered differently to livestock diseases. After examining the trends in contingency plans, we'll now look at the PDS tool evaluation data. Of the 47 PDS tool critical competencies used to evaluate and assist capacity building of countries, I mentioned earlier 2 of the critical competencies which evaluate emergency response and emergency funding are shown here. According to the evaluation and discussion with the veterinary services, a level of advancement for each competency is assigned, reflecting the current situation in that country. This is an overview of the PDS review data from available OIE member countries for emergency response. There are 5 levels of advancement for emergency response shown here, with 5 being the highest. Most regions fall into levels 1, 2, and 3. To provide some context, level of advancement is the level at which veterinary services have no field network or authority to declare or respond to an emergency. Level of advancement 2 is the level at which veterinary services are evaluated to have a field presence but lack legal and financial support to respond. At level 3, veterinary services do have the legal framework and financial support to respond with some contingency plans. These are not updated and not coordinated through a chain of command. Overall, within the OIE regions, 80% of countries' emergency response levels of advancement are equal to or less than 3. Second of the 2 PDS critical competencies evaluated measures the authority and capability of the veterinary services to access emergency funding to respond to an animal disease situation. Again, level 5 is the top level achieved. Level 1 here in light blue indicates no contingency funding. Level 2 has been assessed to have limited funding that is inadequate for emergencies. Level 3 also has limited funding but has additional funds through a political process which has not been exercised or tested. Level 4 has adequate funding resources with additional funds, but in emergency these funds are decided upon a case-by-case basis. For the top level, level 5, adequate funding resources are available with stakeholder cooperation. This table illustrates the emergency funding critical competency assessment over all regions. Overall, 84% of countries evaluated were rated at level 3 or below. This indicates that most countries have inadequate or limited funding for emergencies. So now that we've looked at what trends exist in contingency plans, what can be learned from these trends in order to improve animal disease preparedness? We know that a country with an uncontrolled outbreak is a threat to all others. For the international community to be prepared, all OIE member countries need to be. Recognizing where capacity is when creating a contingency plan is key to improve during an animal disease outbreak. Necessary components that lend to capacity building include bottom-up approaches to top-down management, performing self-assessment and prioritization, and multi-sectoral collaboration, all of which build resiliency and sustainability. Future international exercises should be based on level of individual country preparedness in a stepwise fashion. Regional organizations, including private and public sector partnerships, are key to building capacity as well. Response to current animal disease should always be used as a chance to improve the national capacity for preparedness with ongoing assessment, after-action reviews, and flexible contingency. Countries performing their own self-assessment is critical, and research into novel concepts in emergency management to improve structural and financial capacity should be ongoing. This was a quick snapshot of the evidence-based work being done by the OIE towards improving emergency management capacity. In conclusion, there are definite gaps in emergency preparedness at global level. It will be important to fully understand why these gaps exist and identify the drivers for change in different settings to build capacity in a sustainable way with approaches adapted to the specific country context. We have seen that public health and the economic importance of a livestock export sector can be important drivers for contingency planning. How to develop approaches in countries with a high burden of disease is another issue. Some regions also appear to be better prepared than others. This is often a reflection of the regional context, for example, size of the sector, disease status, and socioeconomics. There are gaps in all regions, but these may be more marked in the African region, the Middle East region, and the Americas region. We can learn from approaches taken in different regions which reflect specific situations. This may create opportunities for greater regional cooperation. There may also be opportunities to share experiences, plans, and even resources at the regional level, since disease threats are often common to countries in a region. This report found that 50% of OIE members have exercised their plans in the last 10 years. This is very promising because the plans need to be tested regularly, and there may be more exercise than were noted for this study. The OIE web platform of national contingency plans acts to improve capacity through sharing experiences and best practices, provides information on the development of standards and guidance, as well as supports capacity building. Listed here are the number of permission-granted plans per region that are now up on the website platform. The OIE continues to work with countries to tackle infectious disease emergencies. To access this site, go to the OIE website, oie.int, and click on the Solidarity heading, then Emergency Management, and click on the map that appears like the one listed here. And with that, I would again like to acknowledge and thank Dr. Keith Hamilton for all of his help, as well as Dr. Mirzet Sabirovich, who helped with the initial project research. And I do want to thank you all for your attention, and I'll hand the microphone back to Liz and Michelle.
Ladies and gentlemen, as we move to Q&A, please feel free to place yourself into the question queue by pressing #2 on your telephone keypad. You'll then hear a notification when your line is unmuted and you can state your question. You can also submit a written question using the chat panel on the lower right-hand side of your screen and choose All Panelists from the Send To drop-down menu.
As of right now, we don't have any verbal or written questions. If anybody would like to write a question or do a verbal question, please do now. Okay, if we have no questions, I'd also like to thank everyone who joined today. It was a very nice presentation, so thank you, Dr. McDougall, for doing that. I also want to let everybody know that our next webinar is going to be on Thursday, May 2nd, and the topic is going to be New World Screwworm. And please be sure to watch your emails for additional webinars that are coming in May, and they'll be sent out in the next week. So if we have no questions, I'll thank everybody again, and have a great rest of your day.
That concludes our conference. Thank you for using AT&T Event Conferencing Enhanced. You may now disconnect.